Nicole, and today I'm going to be having Lipo 400 with fat transfer to my hips and my butt. I wanted to get this procedure done because overall I just wanted to enhance my natural features, and I have been looking at Dr. Marshall's work for a very long time now, and it's been a dream of mine to come to him, so it's finally coming true today. I'm very excited. I think Dr. Marshall's results are very unique. They're very consistent. He's very reputable all around. I live like 7 hours away from here, and I had multiple referrals to go to him, and I definitely think the work speaks for itself. You can see, like I said, consistency and just enhancing what we already have. He's just really good at giving you that extra oomph, you know what I mean? I'm excited to watch my body transform. I know it's a process. Like, I know I'm gonna see my results gradually come to after a few months. So I'm just really excited to see that change. And I just want to have that confidence finally, and I'm just excited that I'm finally doing it. I'm hoping to just kind of enhance like the natural curves that I already have. I mean, ideally I would love like the hourglass shape. I definitely want more projection in my hip area. I would like to narrow down my waist as much as I can with what my anatomy can offer. But definitely like the hourglass look for sure. I think I was waiting for that moment for a long time, and then I just realized there's never going to be a right moment. And as soon as I got the email back from the nurse, I sent my deposit, I set my date, and I think it works out great because we still have like maybe 2 or 3 months before summer, so I feel like I should be somewhat good by then, fully healed. But I don't really think you could just find the moment. I think you just really have to go for it and just do it. If that's what your heart desires, just send the deposit, just put it down, get it scheduled, and it feels right now. It feels like the perfect time.
Good morning.
Good morning.
Are you ready?
Yeah. A little bit, yeah. It's kicking in. We're here, finally. It's like a dream come true today with you. I'm so excited. Okay.
All right, so I'm just gonna put some marks on you, and this will kind of outline the areas I'm gonna treat today. So our goal today is, we really want to focus on removing as much fat as possible. She's had previous lipos. The goal is to remove safely enough fat to give us that hourglass figure that we're hoping for. We never remove 100% of the fat because that will lead to lumpy, bumpy, irregularities, and waviness. So always leave a nice thin layer under the skin, but we want to leave remove enough to where we can snatch her waist and still have enough to really expand her hips, which is her primary goal, and then the butt as well. Liposuction often induces what I call addition by subtraction. So often when patients don't do their arms and I make everything else smaller, including their back, their stomach, now all of a sudden their arms appear larger. So the whole goal is to make everything harmonized. And by liposuctioning the arms along with the torso, it gives a really nice, sleek, feminizing look to the whole body. So oftentimes you can tell someone's had surgery because they have a great torso, great stomach, great back, but then they have overly large arms, and that's almost sometimes a giveaway that someone's had surgery. Often patients will ask, will I bruise after surgery? With the techniques I use, including Vaser, and I use special medications during surgery, rarely do I get a lot of bruising. However, some patients are more prone to bruising, especially if they eat certain foods in high quantities like garlic, or if they consume a lot of alcohol. Some people have disorders of their blood system or the platelets, which do increase their risk of bruising. We try to do a very thorough screening before surgery to identify those things. Even with that said, some patients will bruise more than others, but we always check your labs before to make sure that everything is as close to normal as possible so that we ensure a safe surgery. I use a lot of pain medicine, my 2-method solution, which helps keep her comfortable for the first 12 hours or so. I always encourage Tylenol, Motrin, narcotic pain medicine as needed to really help with the discomfort. She's been through it before, but she's never been through Sculpt Lipo 400, so things will be a little bit different. But she'll be sore, like a really, really tough workout. Typically, patients will say that their arms tend to hurt more than anything else with a lipo, but overall, most of the discomfort is because you can't really sit on your butt or lay on your back, so you're always on your stomach, and sometimes your face gets swollen, and that's really the hardest part of it. But it's very tolerable. Thousands of women do this surgery every day, but yes, everyone has slightly different pain tolerances overall. You ready? Let's do this.
Sculpt.
All right, ready for a timeout? All right, so our patient today is a 28-year-old female who's here for Vaser Lipo 400, lipo of her arms, and BBL. She has no known drug allergies, is that correct?
Correct.
Okay, she's currently supine under general anesthesia. The SCDs are on and confirmed to be working, correct? Hot dog is on above and below for warmth.
Correct.
TXA and ANSA, given
Give
down.
1 minute after the lipo.
Her hemoglobin today was 13.4, up from her pre-op of 12.6. Any anesthesia concerns?
No anesthesia concerns.
Any nursing concerns?
No.
Any tech concerns?
No.
So in order to do lipo, I have to first inject something called tumescent solution. This is a clear fluid that has something called epinephrine, which helps to decrease bleeding during surgery, and pain medicine. And so it's a clear fluid, and it just comes out like this. And that fluid goes inside, and we put it on top of the fat, around the fat, and that helps to decrease the size of the blood vessels, which decreases the amount of trauma during liposuction. So oftentimes you'll see after lipo you're leaking a little bit of fluid. So most of that is just leftover tumescent fluid. So whatever I put in, I remove about 30% of it. Your body does absorb a lot, and the rest just kind of slowly leaks out over the ensuing days. So I use the Vaser on nearly every liposuction case. The purpose of the Vaser delivers ultrasonic energy, which helps to break up the fat. So it allows me to remove the fat in a less traumatic way. And so I like it because, number one, it takes a lot of stress and pressure off of my body, but it takes a lot of stress off of you as well. And so by delivering this energy, it helps to get smoother contours. I am able to see less contour irregularities, and I'm able to remove the fat from you in a less traumatic way. So that's why I use the Vaser with nearly every liposuction case. So I don't do Lipo 360, I do something called Lipo 400. And oftentimes I'm asked what that is. Well, I see a lot of patients who previously had Lipo 360, whether they had it here or they had it abroad, and they'll come back for a revision and I'll notice a lot of extra fat or a lot of untouched places. And so with the extent of my lipo and the areas that I do, there's no way I can associate it with 360, which is a very commonly used term, but leaves a lot of untreated areas. And so my goal is to really contour the torso, not leave a lot of fat behind, and to completely remove fat in those unwanted areas, especially the bra roll areas, the axilla, the upper back. Those are areas that tend to often get missed with Lipo 360. So when I do liposuction, I use something called power-assisted liposuction. So this is a hand piece. It has a motor in it. It vibrates, and that actually helps to make fat extraction a lot easier and takes a lot of the workload off of the surgeons. This hand piece usually gets about 2 to 3 hours of work for every case, but it makes my hands, my wrists, my shoulders operate much more efficiently, so we can get you in and out of the OR in a short amount of time. So as I'm doing lipo, you can see the fat starting to come out. Depending on your diet, some people's fat is a lot more bright yellow, some people's more of a darker orange. Think of kind of like an egg yolk. You've seen egg yolks that are bright yellow, some that are dark orange. Your diet definitely affects it, along with your genetics. The goal is never to remove all the fat, but just to remove enough to give you a nice contour without skin irregularities. And so this side has already been lipoed. There's a nice curvature to the lateral breast here. And so that will help us transition into that nice hourglass waist that we're going for. So is liposuction safe, or what makes liposuction safe? I think a lot of it depends on the surgeon you choose. There are some people who are trained in liposuction techniques. In the United States in general, we typically do not receive a lot of education during our residency regarding liposuction. And we often have to do aesthetic fellowships or additional training in order to get that training that we need. So a lot of my training came after I finished my training programs, and ended up going down to Brazil and Colombia, where I learned some more advanced techniques to keep it safe. Things that we do to keep it safe is we don't over extract fat. We don't remove a lot of bloody fat, because when you do, you lose a lot of blood, which makes your recovery a lot more difficult. So in the right hands with the right tools With the right experience and training, liposuction is extremely safe. I'm often asked, is anesthesia safe? Well, as a surgeon, I need general anesthesia to do what I do. If you want the Dre sculpt, I need general anesthesia. And you ask why, oftentimes I do fairly aggressive lipo. It's still safe, but it's aggressive. And it's more aggressive than what anybody could do awake. And when you're asleep under general anesthesia, your airway is protected, so we are helping you to breathe. You may have heard stories about people going to other countries and saying, I woke up in the middle of surgery and my surgeon wasn't even there. Oftentimes they're using IV sedation or propofol and maybe an epidural, and they're not all the way asleep. I never want someone to have that experience where they're waking up in the middle of surgery, startled, traumatized, and that's why I use general anesthesia. So one area that's often missed during liposuction is the Mons area, or what we call the fupa. If you're getting liposuction, make sure you ask your surgeon what areas are going to be addressed. I often have patients come in and say, I thought something was going to get done and it wasn't. Or they say, I didn't know I was going to have all these incisions all over my body. So when you do your consult, make sure you always ask, where are the incisions, how many of them, and what areas, because you don't want to be snatched in your stomach and your waist and then be left with a very puffy area down below. So oftentimes patients ask, do I use drains? I don't really consider this a drain. This is a small piece of silicone, and I leave this inside of the pubic incision, and it just basically helps to keep that fluid moving out and the incision open for a few days while your masseuse is really pushing all that fluid out. So this stays in for about a week or so. It's just held in place by a single suture, but it helps prevent fluid buildup, or what we call seromas. So we finished the Dre sculpt lipo contouring of the front. So that was the upper abdomen, the lower abdomen, the pubic area, kind of the sides, the anterior flanks, the brow roll, and the anterior axilla. So next up will be to turn the patient over, liposuction the back and the arms, and do the fat transfer. Patients often ask how large is the incision for liposuction. If you kind of zoom in here, you'll see that incision is just big enough to get my cannula in to remove fat. And so they're really not that large. We try to put them in areas that are inconspicuous or not easily seen by others. So I'm going to do arm lipo today, and I make a tiny incision in the elbow. And when you're getting massages, oftentimes you'll get some fluid coming out, and that's just leftover tumescent fluid. It's very normal. That's why we leave these incisions open, to get all that extra fluid out, and that helps decrease your swelling a lot faster. All right, so I'm gonna liposuction the arm. I'm gonna go through a tiny incision in the elbow here. So the areas that are included when I do the arm lipo, I always do what's called the lateral arm here. People call this the posterior, and then the medial. In addition, we don't want you to have overly large shoulders, and so this area that's considered the deltoid area, that also gets liposuction. Now this patient has had lipo of her arms before. Everybody has a different comfort level with how aggressive they're going to be. I think she still has quite a bit of fat left, so let's see how much comes out today. So our patient, she had previous arm lipo. I did her right arm, and you can see I was still able to get out about 250 cc's of fat just with my techniques. I just try to be a little bit more aggressive and really try to contour that arm when I go in. Try to give you what you pay for. All right, so all arm lipo is not equal. So like I mentioned before, our patient had previous lipo done elsewhere to her arms, and I just completed her arms, and I was still able to find another 500 cc's of yellow fat that was left behind. So part of Dre sculpt, part of the whole Lipo 400 is I try to be a little bit more aggressive so I can really try to clean you out without compromising your skin or your blood flow. So I can always find the fat, don't worry. So this is before liposuction. I just want you to notice the transition from her buttocks to her lower back to her middle back. And so I want you to compare that to when I'm done. All right, so doing a Dre Sculpt BBL, doing it safely with ultrasound. So if you look here at the screen, what you're seeing is the muscle down here, and then above here is the fat. So she's actually had a previous BBL done elsewhere. She's here for round 2, but you see a clear delineation between the muscle, and this is the fascia on top of the muscle, and the fat. So when we're doing a BBL, when I do it anyway, I inject fat only into the other fat. Like if you put it into the muscle here, that's a little bit more dangerous. There are blood vessels in there, and you could end up with a fat embolism, and that's where bad things could happen. So by using an ultrasound, it helps me to confirm my anatomy and to make sure that I'm being safe and always above the muscle. Now if you look at the screen, you'll see kind of a shiny metallic thing that's moving. That's my cannula. So I have fat above, and then I have muscle below. So I'm right where I want to be. I'm in the deep part of the fat, but I'm still above the muscle, and that's where I'm going to place the fat. Now you can kind of see those gray lobules that are forming. That's actually the fat that's going in. That little shiny thing right on the right of the screen, that's the tip of my cannula. So the fat is going in. You can kind of see it there, but you can see we're above the muscle, where it's safe. Now, are there surgeons that do inject the muscle? There are. There's those surgeons in the United States that do it. The reason why they do it is because more fat will survive if you inject the muscle. You will get even more extreme projection, but at what cost? Someone losing their life, to me, is not worth that little bit of extra flair. I'd rather have you alive with a natural looking butt than 6 feet deep, if you know what I'm saying. All right, so I finished the Lipo 400, so we've done the arms, the back, the hips, and the flanks. So oftentimes I can lift up the patient's legs, and I can assess for symmetry on either side. So that really helps to see if I've gotten enough out of each flank, and allows me to get better hip visualization. Can you see the difference? So you saw the before, and now you see the after. All right, so we're all done. I did Vaser, Lipo 400, Lipo over arms, and a Dre Sculpt BBL. So as we talked about before, she had previous Lipo before, but despite all that, I was still able to get nearly 4 liters of fat out, put over 1 liter in each hip and buttocks total, and we're able to really carve out her lower back, really define her arms really well. She didn't want to be too large, just wanted to add a little bit of projection, which we were able to successfully do today in about a case that took about 3 to 3.5 hours.